My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to D.O or Do Not. If you are interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
My name is Aaron Plummer. I'm a pre-med student at the University of Central Florida, and you're listening to the D.O or Do Not podcast. This week, we're joined by Dr. Gaudin, a renowned neurosurgeon known for his expertise in spinal surgeries, endovascular interventions, and deep brain stimulation. His innovative techniques and dedication to patient care have made a significant impact in neurosurgery. Dr. Gaudin will share his path into neurosurgery, the challenges of residency, and strategies for success. He'll also discuss his practice in New York, the hurdles of securing a position in a major city, and his approach to work-life balance. Finally, he will offer advice for aspiring neurosurgeons and insights into how the field is evolving. I'm confident you'll find Dr. Gaudin's experience and advice both enlightening and motivating. This is a conversation you won't want to miss.
Xavier, thank you so much for being with us tonight.
Good to be here. Thank you.
Can you say your last name for us?
So I pronounce it Gaudin. It's French originally. There's another way to say it in French, which is go down, but I don't make people go that far. So Gaudin is plenty good.
I'm just going to call you Xavier. That'll be much easier.
No, that's perfect.
First of all, you're a neurosurgeon, which is super cool. And when I think of a neurosurgeon, I always think of people saying, what do you think you are, a rocket scientist? Or what do you think you are, a brain surgeon, right? So a neurosurgeon is a brain surgeon. Do you think of yourself as the smartest of the smart?
That is the joke, right? The joke, I even say it's, come on, guys, it's not brain surgery. We can do this, which is a more funny coming from me. It is perceived that way, definitely by the community, which I think is probably a drive that makes people want to be a neurosurgeon to some degree, along with other things. But, the reality is it's a job like any other job. And once you're used to doing something and things become repetitive, it just becomes like anything else. And you realize that the complexity could be just as great as many other professions out there.
For those of us that don't know that much about neurosurgery, tell us a little bit about what a neurosurgeon does, what the breadth of practice is, and maybe specifically what type of patients you see and what it encompasses.
Neurosurgeons are physicians that are subspecialty trained in surgery that treat diseases of the brain and the spine, and also to some degree of the peripheral nerve, depending on how specialized it may one be. But mostly the brain and the spine. And it involves treating different pathologies, the spine, and making structural changes to those pathologies to reverse the disease process. And that includes anything from oncologic versus tumor. There's also a lot of degenerative aspect, especially spine, and so on and so forth.
And as far as operating on the brain, that's crazy, right? And Netflix special, they show neurosurgeries. Do you think that's realistic? And is it amazing to take a drill to somebody's head and start playing with their brain?
Yeah, I think it's pretty realistic. And a lot of times these shows, they try to make it seem much more complicated than what things actually are. But, when you take a step back, see what you're doing, it is, pretty impressive. And you do feel pretty privileged to have the ability to do this. But the reality is day to day, when you're doing these things day to day, it just becomes just like anything else, just a normal day at work at that point.
I don't know, you seem very confident and very humble about the whole thing, but it seems pretty spectacular to me. So can you tell us a little bit about what a normal day looks like for you? What time do you wake up in the morning? And can you take us through an average day or an average week for you?
So there's two aspects of the job, right? One of them is the hospital aspect, which is where you do your surgeries and where you also take call and see things, disease processes and pathologies that come through the hospital. So I do that about 3 days a week. Those days typically start earlier since surgeries usually start at 7 or 7:30 in the morning. Typically, there'll be a couple of surgeries being done, as well as handling anything else that comes through the door of the hospital, different types of neurosurgical pathologies. And then there's a clinical aspect, office aspect, an elective aspect, we'll say. And that I do about twice a week. Now, during those office times, this is when I do see the follow ups from the hospital as well as the patients with after surgery care. But there's also all the electives that we see through the clinic. Now, granted that more of the pathologies that we see in the clinic tends to be more spine itself in the degenerative setting. So that includes different type of degenerative processes that are causing pressures on the neural structures that may or may not require surgery, as well as some degenerative instability like dynamic spondylolisthesis, which becomes the bulk of it electively. There are occasionally some tumors and some quote unquote cooler cases that do come through the clinic, although these tend to be more acquired through the hospital given the acuity of the situations.
So can you give us an example of maybe some cases that you did last week or some general cases that come to mind, sort of your bread and butter, and then some really long, cool cases? Just briefly give us some idea of what you do.
The bread and butter, just thinking of last week, there was what we call enterocervical discectomy and fusion, which is a very routine surgery where we go from the front of the neck and remove a bad degenerative disc that may be causing both instability and or neurocompression. We remove it and then we replace the disc with another structural graft to fill in the void. There's also the option sometimes that I do where it's become a bit newer where we actually remove the disc and put an artificial disc in place. So a lot of ways to skin a cat, but that was one of them. Another was a similar process but done in the lumbar spine, where actually instead of operating from the back, I actually operated through the abdomen, quote unquote, or going through the retroperitoneal space to access the lumbar pathology to treat a similar process. There was one where I decompress, so I just removed the structural elements that were pushing on the nerves to decompress, and I was able to do that through a small little tube. And this is pretty routine on a weekly basis of what I do. I did have a tumor last week, cortical tumor that happened to actually be, unfortunately for that patient, a high-grade glioma, which are terminal in a matter of a year or two on average. So there was that aspect. A week prior, I did do a spinal cord tumor, the thoracic spine, which is meningioma, which is much more benign, to just have the ability to regrow over time depending on the grading. So those are the type of pathologies I do. I have been fortunate to stay really broad in my practice and do a fair amount of complex cranial cases, as well as the bread and butter spine that is more elective and that I see through the office.
So now how long do these cases take? So I do colonoscopy, 30 minutes. I assume something like this is taking a little more time. Is that right?
Can't imagine. I don't know how many cases that last about 30 minutes. Generally speaking, spine cases depends. If you're doing a decompression alone, you can do it in about an hour. If you got to do some type of stabilization, you may add a couple hours on top of that, depending on the complexity of things. Tumors, it's a very broad term, or brain tumor. Some of them can skull-based type of approaches. They can easily do 12 hours or plus more, and then some others may take a couple hours if they're just on the surface. It's pretty broad, but yeah, sometimes we do have to stay focused and stand on our feet much longer.
So now 12-hour surgery, that seems unbelievable. How do you do that? Do you have an idea usually before that it's going to be 12 hours and you just go to the bathroom, make sure you empty your bladder before you go in? I mean, how does that work?
You do. You're very much prepared for these cases. And obviously, this is the only case of the day you would plan for the day. You're very prepared and also very excited for that type of case. When you have fun and you have a good time goes by fast. So it doesn't necessarily feel like 12 hours, although it does feel pretty straining in the body and pretty exhausting at the end. There's a part of it that is exhausting, but another part that is also very exciting in terms of what you're able to accomplish and what the effects are going to be like after surgery. When I do get to that time, typically it's not uncommon that we may call in a co-surgeon to either assist or sometimes even take over part of the case. Typically, I'm able to hold it the entire time for about almost that long, just because I want to keep going on the case and I'm just not motivated to take a break. But some other individuals may not do it this way and may take a break in between. But I think, as long as you're try to stay young and try to stay physically fit for these surgeries, that's something you can definitely accomplish.
So now in my office, New York state law says that if you're working an 8-hour shift, after 4 hours, you go for lunch. Does that not happen in the OR when you're opening someone's brain?
Definitely not. There's definitely no laws that I know about that would help us in that case. Staff does get it though, which is nice for them, and it's nice to have a fresh staff also as well. I would not want them to be there the entire time with me and be exhausted.
The rules don't apply for the doc, right? I guess my point is just if you think you want to be a neurosurgeon, maybe some of these things you need to think deeply about. And on the same light, are those cases generally stressful? Is it Doctor Strange? You're playing music and talking to the staff. What is the feeling like during those big cases?
It depends really on the surgeon. I mean, I know surgeons, they blast their music. I know some, they just chat and just make jokes the entire time. Some of it is trying to look away from reality that you're doing something that is pretty intense and where your actions can have big consequences on the well-being of a patient. I tend to stay pretty focused throughout my case. I do like a little bit of background music just so it doesn't sound so quiet, but at the same time, I do want everybody to stay focused in the room and try to minimize the chit chatting, especially for more complicated cases. The way I look at cases, it's always a little bit stressful, but the week prior to the case, because I know there's something big coming up and know I have to prepare for it. And typically the day before, this is when I do prepare much more at length for the case. I look at the imaging and I know every step of the way what I'm going to encounter, what I'm going to do, what's my plan A, B, C, and so on and so forth, to the point that when the case actually starts, I'm actually much more relaxed and focused because I know exactly every step of way what I'm going to do. And so the anxiety is the unknown, right? It's the when you don't know what to expect. But when you know what to expect, or when you're familiar with things and you're prepared, everything goes much smoother.
Tell us a little bit about your neurosurgery call. If you're on call, what does that mean? How do you manage your family on your call days? And what does your call usually look like? How often do you have to go in for emergencies and things like that?
There's a broad spectrum there among different practicing neurosurgeons. There are neurosurgeons that take very little, if no call, but at this point, they're mostly doing just elective spine at that, but not doing what I consider the cooler stuff. And there are some that take just a lot more call. I would say probably on average, nationally, it's if you do one call every 5 nights or every 5 weekend, the Q5 we call it, that's a pretty good practice. I'm fortunate to be in a large group. I'm actually on call every 8 nights and every 8 weekends. So it's very manageable. I do not feel like call is a burden. I'm overworked with call. And in fact, I actually look forward to it because it's only once every other month. And in residency, it was almost every weekend. So there's a part of it that I miss sometimes, but it's very manageable. And you can titrate this based on what you want to do in practice. All options are there. And also call, whether it's every 4 or 5 nights, can be very different in terms of the practice setting that you are in the hospitals in which you take call. There's a big difference between taking call at a level 1 trauma center or even taking call for multiple hospitals, which is sort of the situation that I'm in with my group, versus taking call at a community hospital where emergencies happen rarely. In that case, I've known surgeons that take call every other night and they still are able to manage really well at work-life balance.
One of my best friends is an interventional cardiologist, and say an acute myocardial infarction comes in, and I believe he has a 45-minute door to needle time in order to do cardiac catheterization and open up vessels. Do you have that sort of acuity usually when you're on call? You have to get to the hospital where somebody's having an acute issue, or is it usually manageable over the phone, or you can get there in a few hours? What do the emergencies usually look like?
In my call setting, one of the hospitals is a level 1 trauma center, although it tends to be a less busier one. It doesn't happen too often, at least because I'm taking call every other month. It doesn't happen too many times in a year that I have to go in the middle of the night emergently. In different settings, you definitely can have that where frequently you go in the middle of the night. When it comes to, they say time is brain, right? So if something needs to go because there's pressure on the brain or possibly even the spinal cord, the sooner you get there and you do decompression, the better the outcome. Then the guidelines are a lot more strict in the setting of trauma because there are certain accreditation and credentials that they have to meet. And usually that's about 30 minutes. And it's not 30 minutes until you decompress the neural elements. It's really 30 minutes until you get to the hospital. It's not as strict as interventional cardiology or even stroke interventions, which have much stricter guideline and timing requirements when it's more from the time to call a stroke to the needle placement. So it is a little less stressful in that sense. Essentially, you get there when you get there, right? It's not like you have to stress about living really close to a hospital so that you start your interventional within half hour.
My last general question to help understand a little bit about parallel professions. I know orthopedics can do a specialty in spine. Can you tell us a little bit, maybe somebody that was interested in doing surgeries on the spine, what the difference between pursuing a career in neurosurgery for spinal cases versus pursuing a career in orthopedics and doing a specialty in spine?
Spine surgery is a broad term because it can involve the degenerative setting, which is something that is shared among both neurosurgeons and orthopedic spine surgeons. And it can also involve doing surgery more within the neural elements, the spinal cord, nerve roots, and typically that's in the setting of removing tumors. When it comes to neurosurgery, you're limited to more the bread and butter of spine, and you don't go deeper than the surface of the nerve itself, we'll say, or the dura, which is where most of the spine cases come from. The training is a little different. Orthopedic surgeons do a 5-year residency and they do 1-year fellowship in spine, although they do have some inherent training just in terms of working with bones and doing instrumentation as well. Neurosurgeons, it's much more. It's a 6 to 7-year residency where you do quite a bit of spine throughout the training. In fact, probably more than 50% of your training is spine. And so it is different in that sense that you do have a little bit more spine training that allows you to maybe do some of the spine cases that are a bit more complex. But they both kind of get you there in terms of the routine spine cases that I talked about at the beginning. I think in terms of choosing whether I should go the orthopedic or neurosurgery route, it's really whether you like just general orthopedic or general surgery better. If you're doing neurosurgery strictly to only do bread and butter spine, you're going to have a pretty miserable residency, doing a lot of things that you're not necessarily interested in just to get you somewhere. And orthopedic may have some more inherent training that elevates you towards doing more, doing elective type of spine procedures. I think it's just a personality difference in terms of do you rather do general orthopedic or do you rather do general neurosurgery if you had a choice between the two before you think about doing only spine?
So I think the general consensus would be the orthopedics are a little stronger, maybe the neurosurgeons are a little smarter. I'm just kidding.
It's easier on the arms to put in the hardware for these guys, right? We tend to suffer more.
We're going to shift gears a little bit, and I'm going to ask you a little bit about you. Can you tell us where you grew up and when you decided you wanted to be a doctor and where you went to college?
So initially, I was raised and born in Paris, France, which is where I'm from. I lived there till about the age of 13, and then I moved to Chicago, and then has resided mostly in the Midwest until I started working as a neurosurgeon. Went to undergrad at Illinois State University. And at that time, I did know that medicine was something I wanted to pursue. Throughout my life until about late high school, I never thought of myself actually going to medical school or even being a physician. Both of my parents and grandfather are actually physicians, all internal medicine specialty trained. Even though I was raised among medical professionals, I was never really pushed or thought of myself for becoming a physician. I wasn't particularly book smart in school. I wasn't necessarily top gunner student. And so for me, the idea of spending 10, 12, 15 years in school just so you can work about twice as much as a career sounded like oblivious and just made no sense at all. Like, why would anybody do that? Why did my parents choose to do that? I always thought of myself doing something more of like the financial or sort of business aspect of things. But then something happened later high school years where I really realized that my real passion in life is really just being there for people when they're at their most vulnerable state, having that effect on individuals. And I've sort of got a taste for it when I was caring for a close friend in particular. I was dealing through depression. I was there for that person. And it really gave me a great sense of reward and accomplishment to make a difference just to physically be there for somebody. And so this is sort of when that my passion developed towards wanting to help people, which is the answer that a lot of doctors tell you when they choose their profession. Now, there are a lot of different professions where you can help people, right? You can help people as a lawyer when they go through different challenges. You can help people do their taxes. I mean, there's a lot of ways you can help individuals, but medicine was really the one where you can help individuals where probably they're in the most in need, right? And they're at their most vulnerable state. And this is really what drove me. It was almost an epiphany, like, wow, I actually really, really want to do this. There was also a little bit of a daring aspect where, like I said, I was, always, the smartest kid in school. I didn't have the best grades up until I started college. And it was almost a daring, like, watch me, I'm going to be a doctor. I'm going to make this happen. And so from the beginning, I was just gunning and became very competitive to make it happen. And so this is when the whole process started, right at the very late years of high school, that I decided I need to go to college, into a good college and get straight A's because I need to make it to medical school.
So, Xavier, tell us about when you found out about osteopathic school. Specifically, I'd love to hear what your parents thought about osteopathic school, being from France, where DOs are very different than they are in the US,
Yes.
and then what your application process looked like.
The way the medical school process works is that a lot of us take a year off between undergrad and medical school because it takes a year just to apply to medical school. And so applied initially at the MD school, and application process closes usually in August or September of the year prior. And me being a procrastinator that I was and maybe still am, I applied till the last minute. I submitted everything. What you have to do is really apply much more in advance, because the application process is a sort of a first come, first serve once you meet the criteria to get in the school. So the classes were getting filled. So after I applied, I was getting replies saying I did have the grades, the MCAT scores, and everything I needed to get into a competitive school, but essentially the classes were all filled. And so I was told, look, you should probably just reapply next year. Make sure you do it early, and I think you still have a good chance. And this is a year prior to me wanting to start. So now I'm thinking I got to wait an extra 2 years to go to school, and I was just very antsy. I was just a fresh undergrad. I worked really hard to have the resume that I needed, and I wanted to get it going. And I knew there was also DO schools, osteopathic schools. And so I did look into that, and I noticed actually their application process closes in the spring of the following year. So I figured, well, that's great. Going to apply there. Now, I did look into it a little bit, and I realized that whatever specialty you want to do, they're all within the osteopathic world. You can still accomplish what needs to be done. And wasn't really too worried about the DO versus MD, because looking further into it, again, it seems like all the options are there. There was also something very intriguing about the osteopathic world. I remember I met an osteopath, we call him an osteopath physician, but osteopath that only does manipulation some years back. And I remember I asked him, I was probably like, early teen. I said, what do you do for a living? He says, I'm an osteopath. I'm like, what's that? He says, well, it means that I diagnose and treat individuals with my hands. And I said, that sounds amazing. And there's very something intrigued to being able to do this, to be able to diagnose and treat someone with your hands. Now, I realize there may be more limitations than being able to treat with lab work and imaging and medicine, but the fact that you have some ability to do that seemed pretty fascinating. So there was a little bit intriguing for me to being able to learn this throughout the school process that I was actually very excited about. Now, in terms of my parents, when they understood that a DO in the US is very much different than the DO that we have in France, which is more limited to manipulation, they didn't really care which one I would choose. Now, my grandfather did tell me once, he actually swore by osteopathic doctors. He was treated by one for an acute back pain radiculopathy type of picture. And he said he was absolutely cured by having just a one session of manipulation with one. And he definitely swore by them. There was also a time where conventional medicine was a bit more limited. We didn't have as much medicine and as much resources as we do now to treat things. And so that was also a time where the hands-on manipulation had a lot more value before we had this technology. So in that sense, I was very pleased and very happy to do osteopathic medical school. I did get into a few, and I ended up going to University of Pikeville, Kentucky College of Osteopathic Medicine, mostly because my mother at that time actually had moved and had a condo, was living in Lexington. So I figured I'd just be close to her. And it was also partially tuition. These schools are all private, so I don't have to stay. The in-state tuition doesn't really exist in that sense. So there was a combination of things.
So you're living in Chicago, you moved to Pikesville. Tell us a
Mhm.
little bit just about what Pikesville was like, and then tell us a little bit about your experience in school and when you decided you wanted to go into neurosurgery.
Yeah, I mean, it was a little bit of a culture shock, Appalachia, we call it. So it's very different than the city. Look, I'm from France originally, from Paris. It was already culture shock coming to the US. So it was something that I was used to dealing with, and something that I wanted to look at. I'm always interested in knowing how other parts of the world work and how other individuals are in different part of the country, and in terms of their values and how things are and how things function. But at the same time, you're in school. You don't really live there. You're mostly just go straight to school, straight straight home back and forth and just studying. So it's not like I felt like I was fully living there. I was just mostly studying and working the entire time. And so the experience was good. I was very pleased with my education. I mean, it got me where I am today, and I do feel I'm not going to say superior, but at least at the same level as any other neurosurgeons that I work with. And keep in mind that all my partners are Ivy League trained MD neurosurgeons. Pretty much essentially all of them are, and definitely very much playing in the sandbox with them. So again, very happy with my education. I do feel that the osteopathic education has given me much greater knowledge, being able to treat and just the understanding of the musculoskeletal system, which it's a bit of a red box, I think. It's not as objective as other organ systems that you learn in both MD and DO schools, but musculoskeletal system has a bit more of an anecdotal and hands-on approach that was very much present in the osteopathic medical school that I don't think my MD counterpart were experiencing as much. So that I do feel a sense of superiority in that sense, which is something also that I treat a lot in neurosurgery, given a lot of pathologies comes with musculoskeletal dysfunction and low back pain.
Tell us when you decided you wanted to be a neurosurgeon and what you needed to do. Obviously, this is a very competitive, coveted specialty. Tell us when you decided you wanted to do it and what you did to get into a residency.
Neurosurgery, even surgery in general, was not something on my radar at the beginning of the school. Definitely thought more of myself as an internal medicine guy, which is what you learn in school for the most part. You learn medicine. You don't really learn anything about surgery aside from anatomy. So I was very passionate about learning these different organ systems and how it all works. And I did also pretty well in school. So the more you know something, the more you tend to like it. So this is how it started. And then, when you start looking at these different specialties, you realize that they're very different from one of another. The life of an everyday pathologist is very much different than a trauma surgeon. So it's not like we're all doctor, we're all the same. There's a wide area of jobs out there with different specialties, and it becomes pretty challenging because they're so different and there's so many of them. And at the same time, you're not really experiencing any of them firsthand. So you're trying to imagine, what do you like? Do you like the hospital more? Do you like the office more? Do you like surgery? Do you not like surgery? You don't know. You never get to do surgery until residency in the end. It's just more of a feel. So the reason why I chose surgery, there's really three aspects of it. The first aspect is the neuroanatomy. I was very fond of neuroanatomy. I had an amazing professor, Dr. Suniera, and I just really loved the interconnection and the complexity of the way it's all interconnected. So that was one part of it. Now, I also liked many other organ systems and fields in medicine. I was a big fan of GI, for instance, specifically upper GIs like hepatology. I loved endocrine. But then when you look at something you may like in school and you look at the day-to-day job of it, it may not be something you like. Endocrine, for instance, is mostly all clinic, outpatient office based and has very little hospital involved. And I knew hospital was something that I wanted. So then you start, even though you do have a few areas of medicine that you like, you start looking, what type of job do I think I would like best and will fulfill me most? And with neurosurgery, I did find that there was, first of all, a lot of variety within the different types of surgeries that are out there, within the different types of approaches that we use. We really operate on the spine and the brain from a full 360 approach. It includes peripheral nerve. It can include more vascular aspects, a lot of variety there. You can go from doing big open whack jobs and do big spinal deformity to doing fully endovascular type of work, or even deep brain stimulation, which becomes more of a procedure. It's all these options are there. So I like that because, again, you're joining to a specialty where you don't exactly know what you like or not like. So it's nice to have all these options available within your field. Another two other things that I liked about neurosurgery, one of them was the fact that there was still a lot of medical management involved. And like I said, I like internal medicine. I learned about it for all these years at school, and I wanted for this to continue on in my field. And I feel like neurosurgery, unlike other surgical subspecialty, it's not as much divided. For instance, you get urology and nephrology, you get cardiovascular surgeons and cardiologists. Everything is very much divided between medicine and surgery. And with neurosurgery, they really hung on to the medical management. And in fact, it's still very much pushed on the neurosurgery boards today. They do want you to keep up with this. And that includes ICU management, that includes management of elevated intracranial pressure, all non-surgical type of managements we're talking about, and also dealing with endocrinopathies related to tiroid tumors or endocrine type of tumors. So I did like there's some aspect of medicine that I could continue on within the surgical field. And then lastly, something I like about neurosurgery is you dealing with very sick individuals, or you can at least. It's not all neurosurgery, but there's a lot of ICU management and dealing with people that are most at need. And for me as a physician, my mission to be there for individuals and treat them, I felt that it was the best place to be when someone was very sick. I mean, it's not good for the patient, but it is much more rewarding to treat somebody who's extremely sick and making them better than somebody who's a bit healthier and just needs less help from a medical standpoint. So those are sort of the pillars, the reasons why I chose the field. But if you look a step back, why did I really choose neurosurgery? I mean, that was my reasoning. But there's also another reason why I chose neurosurgery. And I think that's the same reason why every neurosurgeon chooses neurosurgery, is that it is perceived as the top field, perceived as the most complicated, the one that the most respected, it's the one that has the longest residency. And so, let's talk about myself or other neurosurgeon, it's a calling to do the most difficult thing out there, take me to the top of the field. And so there's that aspect. And I think I share this with many other neurosurgeons.
So great. You decide you want to be the top dog. You want to be able to do the hardest procedures. You want to be able to operate on people's brains. How do you get there? What did you have to do? Did you do research? Did you do rotations with neurosurgeons? Did you showcase? How did you get into the residency? And tell us what your application process looked like.
Yeah, it's really anything and everything. And you have to do this from the beginning. And I knew from the beginning that I would think I would want a competitive field because I would want the field that everybody else wants. This seems to be the best one to be in. There's a reason for that. The application process might have changed a little bit since then, because nowadays board scores are less focused on grades. It's more about passing fail. So there's different ways now to make yourself stand out as competitive. But in my time, we did have grades, board examination in school. And so the first thing is you got to be on the top of the class, or at least I would say 90th percentile plus. From the beginning, from the first day of school, I remember my first test, I was around the 50th percentile, and it really bothered me. I'm like, I'm not used to doing that. In undergrad, I was always had the best grade. But then you realize all those best students from every undergrads are with you right now in that class. And so this is why. So I did have to come up a little bit over the next few months and make it happen. So I was 90th percentile, or at least close enough to be on top of the class. Grades do matter to some degree. What matters the most really in my time, which I don't think it's as the case as much, was really the board examination, because that is a standard exam that is the same across every school, unlike grades that could be very different across from one school to another. And for that, generally speaking, the threshold was again 90th percentile. If you didn't get to the 90th percentile, you sort of didn't meet the threshold enough to be looked at as an applicant. If you do anything above it, it doesn't seem to matter as much. If you had the top score in the country, well, it's great, but now there's so many other factors to look at. You sort of pass the bar to be looked at more in detail. So that was one aspect. And then everything else is the extracurricular. For the most part, what's most respected is the research, and especially not just quote unquote doing research, but actually being published and putting your name on papers, preferably for more prestigious journal. This is probably now what I think is really the most competitive, since the scoring aspect and the competition has fallen through. And then after all this, there's obviously the personality factors. It's great to be a good candidate, but everybody looks at you like, you're going to be in that program dealing with those residents and those attendings for the next 6-7 years. And so you have to be somebody we can get along with, somebody we can take constructive criticism, and who's a good soldier. I did all that, and this is what got me there. I have to say that the neurosurgery application and neurosurgery applicants will say it's a very self-selected field. I know that when you think about the most competitive residencies to get into, it's really based on the supply and demand, right? It doesn't mean that necessarily the most competitive, but there's a far fewer spot than there are a number of applicants, like dermatology, for instance. There's very little spots, a lot of applicants. The direct plastic surgery integrations are also very competitive because of low spots, and neurosurgery is also in that area. There's just not that many spots, and so they tend to be, in a way, the most competitive by the number of, if you look at both the number of applicants that are applying for the number of spots, as well as looking at the overall board examinations and where do they fit in that category. Now, unlike some of these other fields, the thing about neurosurgery is, like I said, it's very self-selected. And everybody really unofficially, one day, I went to one of the administrators, and she kind of told me off the record, sort of like who was applying. And everybody had 90th percentile plus on their board exam. Those were all the applicants, versus other fields, people that are more in the middle of if you have an individual who's not necessarily the top gunner in the class, he's not going to want to do neurosurgery, but he may do some of these other fields that we talked about because it is perceived, versus dermatology is perceived to be less hard than neurosurgery. So again, because of this, it is a very self-selected field. And even though I felt like I was such a great applicant and I had all the T's crossed and all my I's dotted, I realized every single applicant and that form had similar things or even better. And the ratio of applicants number of spots were still pretty small. But in the end, I think what got me through is being able to network, being able to get close enough. So I think in the end, even though I did really have a good resume, it was comparable to everybody else, I think what got me over the top was the fact that I was able to connect much better with the residents and the faculty, especially a program that I ended up joining, which was my first pick, by the way.
Amazing, Xavier. Amazing. Now you get into your residency, you finish your residency. Tell us what it was like looking for a job and how you ended up in New York with a bunch of Ivy League trained neurosurgeons and how that interaction is in practice.
After residency, you'd be surprised that finding a job in a competitive metropolitan area is actually very challenging and very competitive to get. There's plenty of neurosurgery jobs out there, but they tend to be outside of the big cities. And so when you're a new grad and you don't have the experience and you're not board certified, it will actually be pretty challenging. And it was a little bit deceiving to see this after that much hard work, both in undergrad, medical school, and a residency. You sort of have to prove yourself for a few years before you get to have those jobs that are more competitive and that are more wanted by the average neurosurgeon. People generally speaking, rather live in the city. So New York is probably the best city for me that I want to live in. And the way it happened was really through a recruiter. It was a practice that I felt very privileged to be part of. It's a practice that hires every 5 to 8 years, essentially. Essentially, every 5 to 8 years, they get a new batch of younger neurosurgeons that kind of out of training, and they hire them. And because it is private practice, it is competitive, especially doing this in the New York metro. And a lot of individuals end up not making it through or not able to stay within the practice because they're not able to keep up with the competitiveness. And so I chose New York because, first of all, it's an easy access to go back home to France, which I still see my family there about every year or every other year. And it is very international. It does feel like a city that I fit in very well. Now, the practice that I chose, it is a private practice, but what's nice about this private practice is that it is very much integrated with the hospital system and many other of the hospital system, including NYU Long Island, Mount Sinai South Nassau, the Catholic Health. There's quite a few. And so even though it was a private practice job where you do more private practice type work, there was still a lot of hospital work to be done, which is something that I wanted to hang on to, because the most important factor for me when I joined a practice at the beginning was the ability to continue self-learning and continue expanding and continue doing a variety of cases. And I was fortunate enough to be in a practice that gives me all that. Now, it is true that, yes, at this point, everybody in the practice, it is Ivy League trained. They didn't seem to really care that I wasn't. I think when I had the application, they realized I was just a guy for the job, and I did prove them that. And it doesn't seem to really affect me day after day. We don't talk about it. We're all partners. We're all the same level. We all get paid the same at the end.
Xavier, talk to us a little bit about work-life balance being a neurosurgeon. And I know you have a family and young children. How do you balance all these things? And do you think it would have been easier if you had followed in your father's footsteps and been an internist?
I don't think it would have been easier after you're working per se. It's a big misconception that neurosurgeons are just working all the time and workaholics and never see their family. And maybe there was a time for that a few decades ago, but now, medicine in general, which in whichever field, really has focused more on lifestyle. That the lifestyle specialties have become much more popular. When my grandfather was a physician, he told me dermatology was not that popular at that time, right? It was just not interesting. And now everybody wants to do dermatology because it is perceived as the best lifestyle. It is sort of every specialty sort of gone this way. There used to be a time where a neurosurgeon would live in the hospital and work all the time and every day, day and night. But nowadays, there's been a big change. Both employers and employees in that field are looking for more of a lifestyle. And that's something you can control in neurosurgery. One thing that I tell people when you join neurosurgery, there's a couple of things you can't get away from. You can't get away from the training, which is going to be a 6-7 year program. Right now, you're more restricted to the 80-hour week if you're lucky, but it's still going to be a lot of hours. That's going to be a hard thing to balance. And then you're going to have some type of call, unless you want to do purely elective spine. So that, meaning middle of the night phone calls, some weekend roundings, that's going to happen. But in terms of the number of hours that you work, it's very controllable. You can really make it whatever you want. And in fact, most neurosurgeons that I know, I think they're very modest at their work, and I don't see them overworking like they're perceived to be. I think individuals also themselves like to say they work a lot. If they have a really busy week, they love to focus that 1 week. Yeah, that 1 week I pulled in that many hours, work every day, did that many cases. But the reality is it's not like that every week. One thing that is hard in neurosurgery is it's sort of working steady, right? You're either very busy, everything seems to fall in your lap, and just cases pile up, and you just have a lot of hospital work that just happens all of a sudden, or you have weeks that are actually much slower and you wish you had more things to do. It's hard to really keep it at that balance, at least for me, to keep at the balance where I just have enough work and not too much. But the big picture is that I do feel like I do have a lot of free time, for myself and spend time with my family. I think throughout residency, you learn to manage your time much better. And then you go into a job, a profession where you're working much less hours, and now you feel like you have all this unlimited amount of time, that you didn't have before. In the end, as human beings, we're just procrastinators. We just kind of wait till last minute. We take our time if we have the luxury of time. But as soon as we have obligations or our time becomes more constrained, we can do things much more effectively. And that's what it is. It's about managing your time correctly. And if you do this, whether it's during your career, during residency, you can always make time for the things you want.
Xavier, it's been great talking with you. We really appreciate your time. And I have one last grand finale question that we ask all of our guests, which is, can you give us one piece of advice that you were given from someone else that you feel has been impactful in your career and you would like to pass on to our listeners?
The individual that I looked up to the most in my life and that sort of guide me my decisions to some degree has been my grandfather. My grandfather was a physician. He was actually a rheumatologist. He had an amazing career. He was actually a general in the military. He was a professor for some big schools in Paris. He did a ton of research, over 100 publications, dozens of books, plenty of awards, Légion d'honneur, given by the French presidents. Very impressive guy. And he was in love and passionate by what he did. And that's something that really he passed on to me. And I didn't know it was going to end up being medicine, but I did know I needed to have that kind of passion in life. And so working, quote unquote, it sucks, right? It's not something you want to do because it's work. And when you look at the big picture, is you're going to be doing a lot of this. In fact, 1/3 of your life and many, many hours, but it doesn't have to be work if you really enjoy what you're doing. Now, the thing is that doing what you want to enjoy and doing what you love frequently is also something that many other individuals want to do. And so therefore it's very competitive, and it may not be something you're willing to undergo the path at first. It's going to require a lot of hard work, and it may not be a path that you want to take. But I think it's important to embrace that competitiveness and embrace that hard work, because embracing all this is the reason why you're going to be the only individual with the ability to do these and not everybody else. And in the end, all this really leads to one thing. It leads to success. And success is actually a lot of fun. Success gives you a sense of responsibility, autonomy, job guarantee. It gives you a certain kind of financial measures. And so it's a good way to live. And so it's important to understand that this is where you're working from. I think really also understanding is trying to enjoy the path, because look, for what I did 15 years of school, I don't think it'd be that worth it if I did not enjoy the journey. And it's not always easy to enjoy the journey, when you're work overloading and you're sleep deprived, but there are ways to make it happen. There's ways to make camaraderie. There's ways to look at yourself up the ladder and understanding that you're getting closer to your goals. And those are exciting things and things to be happy about along the way. So again, I think it's important to find your passion and work at it.
Xavier, that's great advice. I appreciate it from you and from your father and from your grandfather. And again, thank you so much for spending time with us tonight.
It's been a pleasure. Thank you.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there is someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.